I'm Dr. Hariyati Shahim Abdul Majid, the Executive of MERCY Malaysia, overlooking the mental health and psychosocial support team. Before the MCA was in place, people did not know about social distancing. It's an alien concept. Being a collectivistic society, we are very physically close to everyone we know. So I think one of the things that we have been able to see is that people begin to appreciate the importance of social distancing. They now know that social distancing will not only save themselves, but also save the people that they love and strangers, people that they do not know. So I think now people are no longer being offended or actually take offense when they need to practice social distance, especially when it comes to going to buy your groceries at the malls or at the shops. People are now practicing that. So how not to make it inoffensive if everyone plays a role or has the mindset that social distancing can actually and does actually save lives. Any types of crisis, mental health issues will be a very great concern. We do not have statistics about the tendency or the suicide rates that have happened as a result of COVID-19. But we need to be prepared for such an eventuality. Those living with existing mental illness may be more vulnerable to commit such acts. So it's very important at the very early stages of any crisis, such as COVID-19, support is given, support is made available and accessible, especially to vulnerable groups. We hope that Malaysia will not see any suicide cases that is related to this illness. The suicide cases that have actually been reported in many other countries have a lot to do with a sense of helplessness, hopelessness, and a sense of guilt. So we hope that people out there who do have these emotions reach out to those around them so that we are able to prevent as much as possible, reduce the risk of suicide cases taking place. COVID-19 brings with it many uncertainties. In normal circumstances, when family members come home from hospital, discharged from hospital, family members would be jubilant and relieved that their loved ones have recovered. But with COVID-19, there are lots of uncertainties that this illness brings with it. So it is understandable that some family members may actually feel apprehensive, worried, not just for their loved ones, but for themselves. When a patient is about to return home, when they're about to be discharged from the hospital, communication begins to take place. But what to expect when they do return home? They need to start talking to each other about the thoughts and worries that they may have concerning the changes that will entail upon the discharge from the hospital. But these are all actually quite normal for people to be worried, to be anxious about the changes that will happen. But with empathy, patients understanding how their family members will respond, and family members understanding the worries and thoughts, and maybe even the traumatic experiences that patients had experienced being diagnosed with the illness, can actually affect the dynamics of relationships. The elderly, especially those living with existing chronic medical conditions, such as dementia and Alzheimer's, and those living with mental illnesses are the most vulnerable, especially those living on their own. So I think it's important that everyone around us play a very important role in being aware of our neighbors who may be living alone. We may have parents who are living on their own. We're not able to visit them. So it's very important, again, for us to be able to check in on them. If you know someone is living on their own, parents, elderly people living on their own, please make sure that you do check in on them. If you do not know how to support them, call our hotline. MERCY Malaysia provides 8 to 5 hotline support system to everyone who may need extra support in terms of linking the vulnerable groups, especially the elderly. We've had people calling and say that I have parents living somewhere else. They may need support, to buy diapers, to get diapers and food. So we have been able to link the elderly with the agencies that provide this kind of support. It's very important that we continuously check in on them. make sure that they don't feel isolated, make sure they don't feel, they don't develop emotions such as regrets and feeling isolated. Yeah.